Hello friends, today in this topic we will be discussing few important questions which come into the minds of common people pertaining to the emergency management of heart attack. This is the second part of this series where we have discussed a few important questions in the first part. Today we will be continuing that discussion and we will be discussing a few more points regarding the emergency management of heart attack. Before I go into the video, I will request the people who are new to my channel to subscribe to my channel, like the videos, comment on the videos and to share the videos in social media if possible. So without wasting any time, let's dive into the topic. First of all, if at all the patient is suspected of having a heart attack, should the patient be eating or drinking anything? If at all a suspected heart attack is there, the patient should not be eating or drinking anything. He should only be swallowing his medicine with the minimum amount of water which is required. But extra amount of water, extra amount of food, juices, anything should not be given until and unless the patient is hypoglycemic. And if the patient is hypoglycemic, then ideally glucose water would be the best way to manage the patient's hypoglycemia. But other than that, nothing should be given to the patient through the mouth, because if at all any emergency procedure is planned, that might become very difficult because the patient might have some vomiting and might land up into aspiration, which might be dangerous for the patient. So nothing should be given in the mouth of the patient. There are some people who might recommend some herbal therapy like ginger and garlic for the management of heart attack, but that is significantly risky because these things might stay in the mouth of the patient, and if the patient goes unconscious, then the things might be aspirated and it might go into the respiratory tract and the patient might die because of them. Any other thing besides the medicine should not be given, and medicines also should be given only if the patient is conscious. If the patient is unconscious, even oral tablets or medicines also should not be given. The patient should be rushed to the hospital as early as possible. Next important question is, usually whenever the patient reaches the hospital, the healthcare professionals try to open up the closed artery which has led to heart attack. Heart attack basically means a condition where the vessel supplying the myocardium has got occluded and the oxygen and the glucose supply to the area has become completely stopped. In these cases, people should try and make an attempt to open up the vessel. In these cases, the medicines, angioplasty and surgery might be helpful. Surgery or bypass is usually not done in case of a acute heart attack in most of the scenarios. Injection therapy or angioplasty is the most often sought for therapy in these cases. The most common injection which is used is a thrombolytic therapy, which is basically a strong blood thinner which opens up the infarcted vessel because it dissolves the fibrin clot which is often occluding these vessels. This thrombolytic therapy is basically a very strong injection which dilutes the blood, or it clears out the clot formed inside the blood, which will help in clearing out the clot which is formed in the coronary artery and restoring the blood flow. Then next question is, what is an angioplasty? Angioplasty is basically a technique in which the artery which has got occluded in the course of a heart attack is opened up using a balloon and a stent. In this case, the patient is brought to a CATHLAB table where under fluoroscopic guidance, a specially designed wire is crossed into the vessel of the patient, and once the wire crosses the lesion which has got the occlusion, then a balloon is dilated and the vessel is opened up and a stent is deployed. This is the best solution for opening up the vessel because the results of an angioplasty are almost guaranteed and you will have a 95 to 99% success in opening the vessel, as compared to thrombolytic therapy which will have a success of around 30 to 50% or maximum 70% in opening up of the vessel. Out of these two therapies, if at all angioplasty is available, then often angioplasty is the most sought for therapy. But if at all there is a significant delay of more than 90 minutes in doing an angioplasty, then the patient might be better off in receiving a thrombolytic therapy until the facility for a cath lab or an angioplasty is available. What should be done when a thrombolytic therapy or injection therapy is successful? Usually when the thrombolytic therapy or injection therapy is successful, then also the patient will require an angiography within the next 24 hours. And if the patient is found to have a lesion which is causing the heart attack, then the patient should be subjected to an angioplasty or an urgent treatment as early as possible so that the chances of recurrence of a heart attack is reduced. What should be done if the thrombolytic therapy or injection therapy fails in opening the vessel? Usually it is recognized by the ongoing chest pain and failure of resolution of the EC changes that the thrombolytic therapy has failed to have its desired action. In these cases, the patient should be taken up for an emergency angioplasty as early as possible. As soon as the patient is given thrombolytic therapy and you find that the effect is not coming, then the patient should be rushed to a cath lab and an emergency angioplasty should be done within the next 1 hour, because the angioplasty will be able to open up the vessel. Any other medical therapy will not be able to do the job. In which cases we tend to prefer lytic therapy. Usually lytic therapy or injection therapy is only preferred when the angioplasty facility is not available, or because of some technical reasons or other issues you are not able to perform an adequate angioplasty, then you might prefer an injection therapy. But in most of the cases, whenever angioplasty is available, then it's better to go for an angioplasty. What is the duration of hospital stay after an angioplasty or in a heart attack. Usually the patient is expected to stay in the hospital for 3 to 5 days. After a successful angioplasty, the patient might be discharged on the third day. Usually after a heart attack which has been managed conservatively and there are no complications, the patients can be discharged after 3 to 4 days. In case of some complication or bad condition of the patient might be expected to stay for a few more days. Next important question is, when can the patient resume his job after an angioplasty or heart attack? Usually after 15 days, or sometimes in case of massive heart attack after 30 days, patient's condition is found to be appropriate and medically fit, then the patient can be allowed to resume his job after 15 or 30 days in few cases. What are the lifestyle changes which are recommended after heart attack? Usually people should follow a heart healthy diet, should exercise regularly, should quit smoking and alcohol, should manage mental stress, should be into regular follow-up of their healthcare providers and continue their medicines regularly. These are the important things which are recommended after a heart attack. What is cardiac rehabilitation and when do I need it after heart attack? Cardiac rehabilitation is basically a structured program which is done in a hospital where the exercise, education and healthcare support and all the important aspects of the patient management after a heart attack are dealt with. Specially designed healthcare or health rehabilitation team is available in hospitals, and this team will be able to guide the overall management of the patient. What should be done if the patient experiences some symptoms which feel like a heart attack but then later it disappears? Usually if the patient experiences symptoms like a heart attack which later subsides, the patient should still seek medical attention. The patient should be dealt like a patient of unstable angina. Angiography should be done, appropriate medical management should be done, and if at all an angioplasty or subsequent treatment is required, that should be done. Even if the patient is having symptoms, the further evaluation of the patient should not be stopped even if the symptoms subside spontaneously, because these symptoms have suggested that there might have been some cardiovascular problem, and if at all it is not dealt with in an appropriate manner, it might recur again in a short duration of time. That is why appropriate care should be done in this regard. In this topic we have discussed what are the important questions which arise in the minds of the common people in regards to a heart attack or emergency management of heart attack. In the next video, we'll be continuing this discussion further and we'll be taking up a few more questions on the emergency management of heart attack. Please see that video also. That will be the part 3 of this videos. Before I end the topic, I would request the people who are new to my channel to subscribe to my channel, like the videos, comment on the videos and to share the videos in social media if possible.